Hey guys, my name's Caitlin, and today we're going to talk about electrolytes and how their imbalances affect your body. First of all, different labs that can affect the fluid volume deficit are serum sodium, serum osmolality, BUN, urine specific gravity, and hematocrit. Electrolyte is the word used for particles that carry a positive or negative electric charge. Electrolytes refer to essential minerals that are found in your blood, sweat, and urine. When these minerals dissolve in a fluid, they form electrolytes. Electrolytes found in the body include sodium, potassium, chloride, calcium, magnesium, phosphate, and bicarbonate. These are required for various bodily processes, including proper nerve and muscle function, maintaining acid-base balance, and keeping you hydrated. Expected reference ranges are sodium 135 to 145 millimoles per liter. Potassium is 3.5 to 5.0 millimoles per liter. Magnesium is 0.75 to 1.25 millimoles per liter. Calcium is 2.1 to 2.6 millimoles per liter. Chloride is 98 to 106 millimoles per liter. And phosphorus is 0.8 to 1.45 millimoles per liter. We are first going to talk about signs and symptoms. So signs and symptoms of hypernatremia include thirst, elevated body temperature, swollen dry tongue or sticky mucous membranes, hallucinations, lethargy, restlessness, irritability, simple partial or tonic-clonic seizures, pulmonary edema, hyperreflexia, twitching, nausea, vomiting, anorexia, increased pulse, and increased blood pressure. Signs and symptoms of hyponatremia are anorexia, nausea and vomiting, headache, lethargy, dizziness, confusion, muscle cramps and weakness, muscular twitching, seizures, papilledema, dry skin, increased pulse, decreased blood pressure, weight gain, and edema. Signs and symptoms of hyperkalemia are muscle weakness, tachycardia, bradycardia, dysrhythmias, flaccid paralysis, paresthesia, intestinal colic, cramps, abdominal distension, irritability, and anxiety. Signs and symptoms of hypokalemia include fatigue, anorexia, nausea and vomiting, muscle weakness, polyuria, decreased bowel motility, ventricular asystole or fibrillation, paresthesia, leg cramps, decreased blood pressure, ileus, abdominal distension, and hypoactive reflexes. For hypermagnesemia, signs and symptoms include flushing, hypotension, muscle weakness, drowsiness, hypoactive reflexes, depressed respirations, cardiac arrest, coma, and diaphoresis. For hypomagnesemia, the signs and symptoms include neuromuscular irritability, positive Trousseau sign and the C sign, insomnia, mood changes, anorexia, vomiting, increased tendon reflexes, and increased blood pressure. The nursing care management of hypernatremia include monitoring the intake and output, assessing for abdominal losses of water or low water intake, and for large gains of sodium, obtaining a medication history, noting the patient's thirst or elevated body temperature and evaluating it in relation to other clinical signs and symptoms, and monitoring the patient closely for changes in behavior such as restlessness, disorientation, and lethargy. The nursing care management for hyponatremia include identifying and monitoring patients at risk for hyponatremia, monitoring I&O and daily weights, obtaining a thorough history to see if patient is a performance athlete, monitoring patients for confusion and monitoring for a diminished sense of thirst or loss of access to food or fluids. The nursing care management of hyperkalemia includes identifying and closely monitoring patients at risk for potassium excess, monitoring intake and output, and observing for signs of muscle weakness and dysrhythmias. When measuring vital signs, an apical pulse should be taken. Presence of paresthesias, and GI symptoms should be noted. Serum potassium levels, BUN, creatinine, glucose, and ABGs are monitored for patients at risk for developing hyperkalemia. Potassium concentration should be very closely paid attention to, as well as the rate. Hypokalemia, the nursing care and management. Hypokalemia can be life-threatening, so the nurse needs to monitor for its early presence in patients at risk. They should monitor closely for signs of digitalis toxicity, as hypokalemia potentiates the action of digitalis. The oral route is ideal to treat mild to moderate hypokalemia because oral potassium supplements are absorbed well. Be very cautious when giving potassium to elderly patients because the elderly patients have a lower potassium requirement. Also, potassium may be retained more readily in older adults than in younger people. IV potassium is never pushed. Nursing care and management of hypermagnesemia. Patients at risk for hypermagnesemia are identified and assessed. If hypermagnesemia is suspected, the nurse monitors the vital signs, noting hypotension and shallow respirations. The nurse should also assess for decreased deep tendon reflexes and changes in the level of consciousness. Meds that contain magnesium are not given to patients with kidney injury or compromised renal function. The patients with kidney injury are cautioned to check with their primary providers before taking over-the-counter medications. The nurse should be careful when preparing and giving magnesium-containing fluids parenterally because the solutions differ in concentration. The nursing care management for hypomagnesemia. The nurse should be aware of the patients at risk for hypomagnesemia and observe them for its signs and symptoms. Patients who are receiving digitalis are monitored closely because a deficit of magnesium can predispose them to digitalis toxicity. If the hypomagnesemia is severe, seizure precautions are implemented. If confusion is observed, other safety precautions are put in place as well. Patients should also be screened for dysphagia. Education is key in treating magnesium deficit. The patient should be taught about the sources of magnesium-rich foods, which include green vegetables, nuts, legumes, bananas, and oranges. Last but not least, if a patient has a nasogastric tube and it is attached to low intermittent suctioning, the nurse should monitor for hyponatremia because with the suctioning, it is pulling the sodium out of the body, just like it would if someone was vomiting. Thank you.